and if there's still time, a second question. And so I'll turn over to you, Dr. Hirji.
Hey, thank you, Courtney. Seems like it's been a busy news day already, so it's perhaps a good day for having this. I'll very quickly start off just by covering what we're seeing in terms of COVID-19 in Ontario and locally, which I'm sure everybody is pretty well aware of. And actually, even if you look beyond Ontario and you actually look globally, this is sort of the pattern of spread that we're seeing, where most countries in the world are seeing a very sharp, pretty vertical increase in cases, really driven by the Omicron variant. And when we take a look at here in Ontario, you can absolutely see what's been going on for the last few weeks and just the scale of how high that has been. To highlight how much more quickly cases are rising, if I take a line and draw a line in here to show, how steep that increase has been, and then I draw the identical line over here, you can see how much more quickly cases are rising than they've been really rising at any point previously in this pandemic. Now, what I've shown here is a 7-day average of cases, which smooths out the line a bit, but it also means that what we're seeing here isn't really the current day's cases. It's really the past 7 days averaged out. And of course, when cases are increasing, that means that every day you're averaging out with previous days where cases were likely a little bit lower. And so if I go to just actually cases per day and take out that averaging, a much more, less smooth line, but you can see it's even sharper, the increase and how much difference it is. And you can get a sense of how many times higher we are from any previous wave of infections we've had in terms of our cases. We're all aware, of course, there's lots of struggles to actually get testing right now. And of course, the province is now limiting testing. So we aren't actually even seeing the full number of cases out there. And probably the true number is actually much higher than this. If we look at the percent positivity, that can give us some sense of what might be going on. So you can see cases, testing here is probably about doubled. And even though, testing has doubled, we are still, where were we in November versus now? That's probably 11, 12 times higher in terms of cases, despite actually doubling our testing. And so that, shows just how much more infection is going around, I think, in terms of how many more people are testing positive. And this is, data from the science table showing what's been a trend with the Delta variant versus the trend with the Omicron variant. And you can just see how the Omicron variant has completely overwhelmed anything going on with the Delta variant. There's still a little bit going around, but it's really insignificant to what we're seeing with the Omicron variant now. And you can see here on this graph where the blue represents the Delta variant and the orange represents the Delta variant. The blue represented the Omicron variant that, pretty much in the matter of a month, Omicron from going 100% of cases is now down to just a small percentage of our cases, where the Omicron variant basically spreading so quickly, it has basically replaced it completely. And you can see that, transition was much more gradual for previous variants as it has been for this one. This one is really replaced very quickly. In Niagara, the trend is pretty similar. You can see a very sharp upwards trend in cases. We haven't seen quite the same magnitude of increase maybe as the province as a whole has seen. And it's hard to know exactly what that is. It could perhaps just be we're not having as much testing here done, so maybe we haven't picked up the cases the same way others areas have. It could also be that perhaps things aren't spreading quite as quickly here as they are elsewhere in the province. But I think it's sort of an academic question because regardless, our cases are very high now, far higher than they've been with any previous wave. And probably what we've seen here is an underestimate of how high they truly are at this point. So, obviously, infections is one part of the story. The other part is going to be hospitalizations. And I think the province tried optimistically a few weeks ago to put out a plan where they weren't going to worry so much about cases going up. They're going to be more concerned if hospitalizations started to go up at an unsustainable rate. And, they were really looking at this kind of data, which shows that, while the vaccine was less effective at stopping the spread of COVID-19 here, it was doing a better job at stopping the spread of hospitalizations. And it was definitely doing a very good job still at stopping ICU admissions. And so even with 2 doses of vaccine, they hoped that we wouldn't see necessarily the hospitalizations and the ICU admissions follow, even if the infection was going to be able to spread through people because we wouldn't be able to stop the cases. That, I think, was overly optimistic because, of course, if the vaccine is less effective and more people are becoming infected, this gap of people who are still going to be hospitalized despite the vaccine is going to be applied to a larger and larger number of people. And so those hospitalizations are going to start adding up. And sadly, I think that's exactly what we've seen in the province. And so this is a pattern that we are seeing with hospitalizations, where that upwards trend in cases, hospitalizations tend to lag a couple weeks after the cases. That lag is now coming due, and we're seeing the upwards trend in hospitalizations following from those cases. And I think the provincial announcement today is really a reflection that they've now realized that their thinking was overly optimistic, and the hospitalizations are absolutely going to follow the cases going up. We're not yet seeing the big increase in ICU numbers, but again, ICU admissions have always kind of lagged from when the cases go up. And so are we going to see in a week or two the ICU numbers start to go up? There's maybe some hope that because the vaccine seems to do better against ICU admissions and hospitalizations, that it won't be as bad. But I think we can expect an increase in ICU admissions in the near future now as well. Just taking a quick look here at what's happening in Niagara Health. Niagara Health absolutely seen a big increase in hospitalizations as well, starting to get close to the peak of what they saw during the third wave. And then in terms of ICU admissions, it's going up a little bit, not too much, but again, I think it's a bit early to know what's going to happen there. One line that has been bandied about quite a lot lately is this idea of, is it just inevitable that Omicron is going to spread through everybody and we can't stop it, so we maybe shouldn't worry about it. And I think that's actually very defeatist thinking. I think we're seeing the true impact it's having on people who are being hospitalized. And so it's incumbent on us to try and do something to hopefully protect people's health. But I think if we start looking at other places in the world, we can see that other places in the world have absolutely managed to blunt the impact of the Omicron variant. I just want to show a few examples here. So this is Canada, of course. We are setting straight up in terms of cases. Germany, like much of Europe, was on its way up earlier than us. You can see Germany has actually managed to, not necessarily bring cases down low, but actually, bring it down a little bit. They're struggling in cases relatively high still, but nowhere near as high as us. And that's because they were aggressive early on about closing public spaces, limiting social interaction, especially heading into holidays, and really making some of the hard choices of what is going to slow the spread of infection. When we look at countries like Japan, New Zealand, who've been even more aggressive and also, been lucky that as island countries, they could better control people traveling into their country. They've actually been, despite the Omicron variant, been able to continue keeping cases quite low. So there's absolutely things that we can do here. It's not inevitable that we need to see cases quite this high and see hospitalizations as high. And actually, if we go back 3 weeks, the Ontario Science Table absolutely told us what we need to do. They said that if we did not have any additional measures in society, we would be on this pink trajectory. And we seem to be tracking kind of in the middle of that range going into the holidays. January 1st, we're 15, 16,000 cases. We're probably somewhere up here. So it probably has continued to track along that middle of the pink range. What they said is that if on December 15th, the province had put in place some circuit breaker measures to reduce people's social contacts by limiting interaction in public spaces, reducing gathering sizes and the like, we wouldn't be able to stop cases going up, but we could have blunted them. So instead of being way up here, we could have been down in the 2,000, 3,000, 4,000 numbers of cases and having something much more manageable and having the opportunity to control our hospital admissions going up. And, as they argued here, if we do that, we'd be able to help keep schools, workplaces, places where people, are, really important. We could better do a job of keeping them open, and we would be able to reduce the impact of the Omicron variant. Of course, I think we haven't chosen to do that, and I think only now, 3 weeks later, are we going to start to see that. And what's important for that is, I think if we had done that, we may have had a better chance of maybe protecting our economy. Because I think we've seen over the last few weeks, by avoiding putting restrictions, the pandemic basically has been causing harm to the economy instead. So these are some of the news articles people have no doubt seen. Lots of flights being canceled because airlines are having sick workers and they're not able to actually operate. And that's been true of a lot of businesses. The economy, according to this, could have a moderate impact on the economy because of the impact that the Omicron variant is going to have, because people are going to be too sick to work, but also people are going to be scared to go show up to work, and they're going to stay home and do what they think is going to protect themselves. Forcing a wave of closures in the United States, they're seeing lots of businesses close, and I think we've been hearing about that happening here as well. Messing with their economic recovery. This article is saying that the variant is winning and causing mayhem to our economy. I think by being reactive and not being proactive about some of what we are seeing with the Omicron variant, we allowed the virus to disrupt our economy instead of maybe proactively being able to address it, control cases. Yes, unfortunately, had some economic destruction with the measures we had to take. But if we're going to have that anyway, we could have done it in a way where we at least kept people a bit safer. And of course, if we slow down the spread of infections, we keep it lower in society, that buys us time to do the things that are going to make a difference, which is, of course, vaccinating, where we're seeing right now 2 doses of vaccine is giving people about 15% protection from illness. With that booster, if we have the time to get boosters out, we can get protection up to 75%, which would mean a lot fewer people getting sick. And in terms of preventing severe illness, while we're preventing severe illness 70% of the time, we can get that back up to being over 90% of the time if we get those booster doses. And we have new medications that have come online to treat COVID-19. Health Canada is currently doing the review of these to determine if they will be licensed in Canada. And hopefully very soon we're going to see that, possibly within the next week or two. And by slowing the spread of infection, it gives us a chance to get these medications available, which could actually prevent those hospitalizations when the cases go up, or keep people safe and healthy so they don't actually go and suffer some of that severe illness. So good news is we do now have some of those measures put in place today, so we're going to start seeing the impact of it, but it's going to be a couple of weeks out before we really start to see the impact of that. And unfortunately, I do think we've had some lost time here to maybe blunt the impact of what this Omicron wave could do. I think on top of what the province is doing in terms of these additional measures is, of course, what we all do in our own personal lives, because I think that is going to make a real difference. And so if we avoid large gatherings and really actually, I would argue, avoid any kind of social contact with people where it's not truly essential, that's going to stop some of the virus. If we continue to keep physical distance, that's going to help. We stay outdoors or in well-ventilated places when we're around others, when we wear good quality masks and make sure we wear it properly, covering our nose and mouth. And we, of course, have being fully vaccinated and hopefully get that booster dose. We can do a lot to actually prevent the spread of COVID-19 and the Omicron variant in the coming weeks. And on top of what the government is doing, I think we also need to make sure we redouble our efforts around all of these. And I really want to emphasize the importance of us keeping distance and avoiding gatherings. And the best way to keep distance is, of course, to stay home, not be around others, because that means you have the maximum distance possible that's going to hopefully keep us safe. Final thing I want to just quickly talk about is schools. And I think, schools are really essential in our society. And it's, of course, unfortunate that we have the announcement that schools are going to be delayed in terms of reopening. There's a lot that we've been doing over the past year and a half really, to keep schools relatively safe. We were keeping cases low in the community, which meant that there's fewer people out in the community, such as parents, children, staff people who could get infected out in the community, which meant that our schools were safer. Schools, of course, will reflect the spread in the community. So if we keep cases low in the community, we keep our schools safer. We were trying really hard to test anybody who had symptoms in school so we could identify our cases early. Once we identified those cases, we would isolate that person, we'd isolate their class and cohort, and we'd really stop the spread of infection. And we've not had really large outbreaks in schools. Unfortunately, we have had a few outbreaks, but we've been able to keep them limited. We tried to maximize the spread of students and distance within them within school infrastructure. We required at least grade school students to wear masks. In kindergarten, it was optional, and even in grade school, parents did have the option to opt out their children from wearing masks. And we try to improve the ventilation, filtration of the air to limit the spread of the infection within the school. In all of these, I think we're working relatively well. But of course, we're now in a scenario where cases are a lot higher. And so we have lost one of those key ingredients for keeping schools safe. Also, because in public health, we have had to redeploy pretty much all our staff to now deliver vaccines and booster doses, we're no longer able to do the work of identifying these infected people and isolating their cases and cohorts. And testing is limited as well. So people aren't necessarily always being tested. And so we've lost the benefits of some of these measures as well. And so we have fewer measures now in place in schools in the time when the risk is a lot higher. And so I do think schools are not as safe as they used to be. And I think that is a big concern. And my hope is we use the next couple of weeks before schools reopen to really have the province put in place some additional measures, which I think can hopefully get our schools to be safe again. You know, the first one I think we fortunately got today, which is deciding what is actually open in society. And I would argue we want to keep schools open, which means we have to close other amenities to limit the spread of infection in some of these other public places so we can have fewer infections that can show up in schools and we can keep our children and our staff working in schools much safer. And I think that's a really important step that was taken today, and I hope it's something that we remain committed to as a province towards. I think we need to get vaccinations up among students and teachers, and especially among students, where even first doses for children under 12 remains far lower than I'd like it to be. It's only around 40% of children 5 to 11 have gotten even that first dose of vaccines, and we absolutely need more children to be vaccinated so they can be safe when they go back to school. I think we want to make sure we get testing that's prioritized for schools, both PCR testing, but once the province has rapid tests again, really using them in schools to hopefully identify infections early so we can keep schools safe. I do see the province is saying they're going to prioritize testing for students and teachers, and so that is definitely good news, and I think we need to make sure we follow through on that. I think we want to tighten up what we're doing with masking among students, and what I would argue is that we should eliminate mask exemptions. I think we're seeing that unless most students are very capable of tolerating wearing a mask, the majority of students are doing so, I don't think they should be put at risk by the small minority of children who aren't wearing masks. Obviously, if there's a true medical reason a child can't wear a mask, obviously we should have those. So there can be medical exemptions, but there shouldn't be a parental choice to have their child not wear a mask. And likewise, I think we should have schools distribute good quality masks to children and teachers, making sure they're all wearing a good quality mask that's going to make sure everybody has the best protection in the school. So, a lot of children are wearing some, cloth masks. Some cloth masks are good, some are not very good. They're really an uncontrolled product. So making sure we can give every child a good quality mask, I think, could go a long way to making schools safer. I think we should look at, is there anything more we can do to spread students out to maximize distance and make them safer? And part of that consideration should be, do we go to hybrid learning, where maybe we only have half of the students in class at any one day, which allows you to double the space between students and really increase that distance and potentially make them safer. I think we should look at increasing ventilation and filtration now in every single classroom, not just looking at school-wide. Ventilation could be improved by opening windows. It's probably not the right weather to do that. Maybe, but there's periods where you could do that briefly. Perhaps when kids go out into recess, you quickly open the windows, air out the room, and that will help. And maybe we can bring in some HEPA filters into every single classroom to actually be actively removing virus that might be in the air and keeping the children even safer. And then finally, I think COVID-19 should be added to the Immunization of School Pupils Act. This act gives public health additional tools to stop outbreaks when there's an outbreak in a school, particularly around children who are not vaccinated and potentially suspending those children when there's a risk of an outbreak, to really keep the school safer. And I don't think we should, keep all students who are unvaccinated out of school, but I think we should have this tool available for public health to keep schools safer when and where it makes sense. And I think, right now we're seeing far more outbreaks from COVID-19 than we're seeing from all the other infections. We're not seeing pertussis outbreaks. We're not seeing measles outbreaks. We're not seeing mumps outbreaks. We are seeing lots of COVID infections and COVID outbreaks. And so it doesn't make sense that this infection is not part of this act to give us those tools to protect the students in those schools. Now, I did highlight that, I do want to see vaccinations of children going up. And when we take a look at the breakdown of where spread is occurring right now amongst age groups, we can see the 12 to 29 age group is where we're seeing the highest spread, and that's actually our least vaccinated group. But you can see here, children under 12 remain a group that's seeing quite a lot of spread. And of course, the 12 to 29 age group includes high school students. And so children are definitely a group where we're seeing more infections right now. Our highest vaccinated age groups and the ones who have booster doses for the most part are our elder groups, and they're actually seeing lower spread of infections, which I think is a reflection that that vaccine and that booster makes a difference. And so I think it's really important we work on making sure more kids get vaccinated as they return to school. We take a look at our vaccine uptake across the region. These are first doses. You can see we've now got to 80% of our 12 to 17 age group has gotten that first dose, which is great news, and we can hopefully keep them going up. But we're just over 40% for our 5 to 11 age group. And there's more, this group needs to come up and really join some of the other groups. When it comes to second doses, of course, we haven't really gotten very far with second doses with 5 to 11 children. That'll be kicking into high gear later this month. Definitely, of course, most other age groups are picking up their second dose after they get that first dose. You'll note some of these lines aren't quite, caught up to this first dose, and that's actually because we're fortunately seeing people in some of these older age groups again signing up to get their first dose and making that good decision to start being vaccinated in the case of the Omicron variant. Of course, our big push right now is to get booster doses out to people, and this is what we're seeing with booster doses, where we're actually getting quite good progress amongst the 70-year-plus age group, but there's still a lot of room still to grow. And of course, many other age groups still need to get their booster doses. So it's still going to be, several weeks more of doing this work. Now, when we look at our daily doses administered in Niagara in terms of vaccines, you can see in mid-December, we really got a big increase in the vaccine doses being delivered, as all channels, public health, primary care, pharmacies, all started to do more vaccinations. Even Niagara Health got their gain back in vaccinations. You can see little dips around the holidays, and I'm expecting this number to be back in the 6,000 to 7,000 range and actually exceeding 7,000 in the coming days as we get our new vaccine clinic at the Scotiabank Centre really established and starting to see large volumes of people. One big challenge for vaccination going forward, though, is going to be just the amount of COVID-19 spreading in our community. If we have people who are booked in for an appointment who unfortunately get COVID-19 or get our high-risk contact for COVID-19, they are not going to be able to attend our clinics to be vaccinated because, of course, we don't want people who are at risk of spreading the infection showing up to our clinic where we're going to have thousands of people and potentially spreading it there. And likewise, all the healthcare providers who are delivering vaccinations, if they get COVID-19, they have a family member who gets COVID-19 and they need to isolate, that's going to mean we're going to see family doctors, pharmacists, or public health staff not necessarily always being able to show up for work and be delivering their vaccine. And so that is going to be a constraint for us going forward. In public health, we're actually making a daily assessment every day on what our staffing is to see how many appointments we can actually deliver. What we've got on the system right now is an underestimate to give us some wiggle room in case we do see staff who aren't able to go. And then every morning, we're basically going to be loading up new appointments into the system for people to sign up and appointments actually for that same day. And actually this morning, we loaded up over 400 new appointments once we confirmed what our staffing for today was. And those appointments were very quickly booked off. We have loaded some additional appointments for later in the week. And every day, we're going to keep adding more appointments to our existing clinics. So strongly encourage people every night, every morning, check to see if there's an appointment available. So hopefully you can get signed up for appointments because we're going to keep making more available as we have the staff available and confirm that we're actually able to deliver those appointments. And so with that, I'll stop there and turn it over to questions.
Great, thank you. First on the list, we have Luke, and you should be able to unmute now.
Perfect. Thank you. Yeah, I'm just curious with the changes to the testing that was announced recently, what's Niagara's plan sort of for reporting going forward?
Yeah, it's a good question. We haven't decided what change we're going to make to our reporting quite yet. I think we'll continue reporting daily cases. I don't think you're going to see a change from that. I think we do need to educate the public that daily cases doesn't necessarily represent the full number of cases out there. And I don't think it ever has, but I think it's going to be a much less accurate estimate going forward. I think we're going to also want to be thinking about what are some other ways that we can try and communicate some of the extent of spread out there. Probably putting a bit more emphasis on hospitalizations, where I don't think we're going to see quite that same undercount. But I think you'll see all of the same information still being reported. It's probably going to be more changes in emphasis.
And a follow-up?
Yeah, just I guess what are some of the challenges? Obviously, you've sort of lost some capacity to do that very accurate reporting or more accurate reporting. So what are some of the challenges when you lose that ability?
Yeah, so I think the biggest challenge is we no longer going to have a clear sense of what are the patterns of spread in our community. If we're not capturing all of the cases, we're only capturing a subset who are of severe illness or associated with a high-risk setting. That means we're not going to see what is the pattern of spread for the majority of people out in the community. And so that's going to limit our ability to make decisions. For example, if we need certain local measures or restrictions to deal with local patterns of spread, we're just not going to be able to detect those kinds of patterns of spread anymore. I think it's also going to, really, I think, not give us a sense of, what are, some of the risk messaging we should be putting out. Are there certain types of places where people are getting more infected? Certain demographics of people are more likely to get sick. Are people getting sick from travel or something else? We're just not going to have that information to share with the public to help them make some of the decisions that they might want to make themselves. We're going to have only really information on what's happening in our high-risk congregate settings, in schools, and really beyond that, I don't think we're going to know much about what's going on.
Thank you very much.
Thank you. Up next, we have Richard, and you should be able to unmute now.
Hi, everybody. I've noticed a lot of people around saying they've got runny noses and colds, but testing negative on the rapid tests. What else? Could be going around right now. Obviously there's still other things going around, but do you guys have any sense of anything else that's spreading around? Or
yeah, we do have a little bit of a sense of other things spreading around. There's a virus called parainfluenza that's been going around. Rhinovirus and enterovirus are also spreading a little bit, but I do think actually the biggest respiratory infection going around is still COVID-19. And the probability of you having something is probably pretty high that you have COVID-19. I showed you previously where, on the order of about 25 to 30% of people who are getting tested are testing positive for COVID-19, which implies that a big proportion of people who are getting those colds likely do have COVID-19. Rapid tests are good, but they're not perfect. They're certainly not as good as a PCR test. I'd say they're probably more around the 75, 80% accurate. So even if you test negative on a rapid test, I think it still could mean you have COVID-19. That's why we always really emphasize the PCR testing, because that's much more accurate. And so if you have symptoms, absolutely important that you do isolate to make sure you're not spreading that infection to other people, even if you have that negative rapid test. And even if it turns out that you don't have COVID-19, you have something else, last thing you want to do is spread that infection to others and give them the scare that they have COVID-19, and then they develop those symptoms as well. So absolutely, if you get symptoms of illness, isolate for at least 5 days and until your symptoms are mostly passed, so we can make sure everybody stays safe and healthy.
awesome. And then, with the changes in testing, what should people be doing other than, should they just be isolating? That's it at this point, or?
Yeah, I think that's the key thing. If you are someone who has underlying medical conditions that might put you at high risk for severe illness, you particularly have some sort of medical condition that makes you immunocompromised, you are eligible to get that PCR test. And I definitely recommend you go and get that PCR test. If you test positive, there are medications available, such as monoclonal antibodies, where you can actually get some treatment that'll reduce your risk of being hospitalized. So for those people who do have those high-risk conditions, I think it's really important they still get tested. For others who don't have those high-risk conditions, it is just about isolating. You have symptoms, isolate from your rest of your family, make sure you stay home and don't go out, so you keep that infection just to yourself, don't spread it to others. And if we do that, we'll hopefully keep everybody else safe and keep ourselves safe. And again, isolate for at least 5 days and keep going if you still have symptoms past that.
Great, thank you.
Thank you. Up next, we have Gord, and you should be able to unmute.
Thanks. Dr. Hirji, I know your own capacity is limited because of illnesses and everything else. Is there anything more you can do for schools? I know last year you held the clinics for teachers. Is there any sort of capacity you could free up to have like a one-day clinic to get all the teachers boosted and make them a priority?
Yeah, it's something I've been thinking about internally. It's going to be difficult to do that just because we have our clinics booked over the next little while. The other priority for us is that when we're thinking about who needs to get a booster dose, as much as I think teachers and students are a priority, they're probably not our top priority. I would still say the people who are in their 70s, 80s, they are a higher priority. They're people who are much more likely to be hospitalized and actually potentially even pass away from COVID-19. So what we're trying to do is that if we're able to target more vaccinations to that age group, that's what we want to do first. And hopefully once we're done with them, we could maybe look more towards vaccinating people in the school setting, where I think important to keep schools open, but fortunately not as likely we're going to see the severe illness there. We really want to make sure the older groups who are most likely to get that severe illness get that booster first.
And a follow-up?
And also you mentioned that you prefer to see a COVID vaccine made mandatory for kids along with other vaccinations. Is this something the medical officers of health have put to the province? Because it seems like something that they might agree with, the province. I mean, if they really do prioritize the schools.
Yeah. So just to clarify, the Immunization of School Peoples Act doesn't make vaccination mandatory. It makes a decision that you have to go on record with as a parent mandatory. So you have to decide to vaccinate your kid, or you have to submit a legal statement that you've made a conscientious decision not to vaccinate your child. And so it doesn't force anyone to be vaccinated. Parents will absolutely still have the choice not to have their child vaccinated, but it will, force parents who are maybe unsure what they want to do to make a choice one way or the other. And, of course, we'll be able to hopefully have a discussion with them if they are unsure to help them make that decision. What it would do, though, is in the situation of an outbreak or where we're particularly concerned about the risk, would give us the ability to exclude students who are unvaccinated from schools so that we can hopefully make schools safer. Now, I don't think that's something that we would exercise in the near term, particularly in elementary schools where so few students are vaccinated, but I think it will be a tool that's going to be really valuable in the coming months as we get more students fully vaccinated to make sure schools are safe. This is something that actually the the Council of Medical Officers of Health, back, I believe it was in August, and might have been end of July, went on record with recommending to the province. We have a letter out on the Association of Local Public Health Agencies website with our letter stating that we wanted that. And we've reiterated that request on a few occasions to the province. As I understand, Cabinet is not interested in going down that road, and I don't have any more information on that. But I think as we're seeing, schools at greater and greater risk, I think the value of having that as a tool for us to keep schools safe becomes even more important.
Thanks.
Thank you. Up next, we have Ludwig, and you should be able to unmute now.
There we go. Thank you, Courtney. Hello, everyone. Dr. Hirji, so am I understanding things correctly that Niagara now has very limited testing capacity and also fully booked vaccination clinics? And the question to that would be, when could we expect to see mass immunization clinics such as the ones we saw for the first and second shots, for example? When is it realistic, taking vaccine supply and other logistical factors into account?
Yeah, so I wouldn't describe testing as very limited. I think there's, a decent capacity for testing out there, but it is a limited capacity just given how many people are getting sick out in the community. It's similar to what we've seen in the past, probably even more than we've seen in the last few months, but it's just, with cases are up 20, 30 times, you just don't have, the ability to ramp up testing 20, 30 times as well. I think with the restrictions the province is putting on testing, hopefully we're going to see a better match of the number of tests available and the number of people seeking testing. In terms of vaccination, we have actually been delivering mass vaccination clinics, I'd say, over the last few weeks. We've been doing clinics for booster doses where we've been, well over 1,000 appointments. Starting today, we have access to the Scotiabank Center, which give us a much bigger site. So now we'll be able to start to maximize those appointments to larger numbers, getting up to 2,000 and hopefully building from there to even larger numbers going forward. And I just want to highlight that, it wasn't the supply of vaccine that was the limiting factor. It was really having a physical space where we could do that large number of vaccinations, and of course, having the staff. And we've redeployed the staff. We've freed them up from case management, outbreak management now. And of course, now we have the sites, so we're able to deliver those larger volumes.
And a follow-up?
If you could just clarify, you mean 2,000 per day?
That's correct. 2,000 per day starting off, or this, early part of this week. And as we, get organized with that clinic and get experience with it, we'll be able to start to speed that up and go to larger numbers per day. And that's, of course, just public health, pharmacies, everybody else will add on to that.
My second question then, Dr. Hirji, is also there's, I think, somewhere in the realms of 35 outbreaks ongoing right now. I noticed about a little less than half of them appears to be in long-term in healthcare settings. So how are you supporting those, the staff there now? Like in the beginning, it was very much controlling, spread and sanitation and stuff like that. So how are you instructing those institutions that are under outbreak to go about this new situation with Omicron?
Yeah, so, the same things that slow the spread of the previous variants still work for Omicron variant. They just don't work quite as much, but they still are the same things that we're advising. So the advice we've provided hasn't really changed that much. We emphasize isolating all of the people who are infected or were close contacts. We do frequent testing of people so we can identify infections early. We, of course, have enhanced personal protective equipment. We're recommending in a healthcare setting that when you're seeing people who are infected with COVID-19 or a close contact, that you're wearing an N95 respirator to make sure you have that higher level protection. We have our inspectors go out to observe and instruct them on good disinfection of the area. We also are, advising them on how to improve their ventilation and filtration so that they can make sure that airborne virus doesn't become an issue. Of course, we emphasize the importance of vaccination with at least those 2 doses and then getting that booster dose. And it's going to be provincial policy later this month that all staff are required to have that booster dose. And we've already delivered the booster dose to pretty much every long-term care home and retirement home resident. So all of those same measures, the same ones we're doing. The good news I'm seeing with our outbreaks is while the number of outbreaks is quite large, almost every outbreak is only in the single-digit numbers of people who are actually sick. So we are seeming thus far to have a success in containing the spread of infection. We can't stop people from being out in the community and getting infected and bringing the infection into the workplace, but we're fortunately managing to stop it once it does arrive in some of these high-risk congregate settings. And hopefully that is something that we'll be able to continue. And hopefully as we get staff vaccinated with booster doses, there'll be even more protection to stop that spread in these settings.
Thank you. And up next, we have Penny. You should be able to unmute now.
Hi, thank you very much. I just want to be clear about the message regarding vaccinations. Dr. Hirji talked about the 70 to 80 age group, talked about those who have compromised immune systems, and also about the younger age groups. But the Scotia clinic and any other clinics that are available, any other appointments that are available, they are for all eligible age groups, is that correct?
Most clinics we're going to be offering are going to be for the 12 years and up age group. And we have people booked in for first doses, second doses, and of course, lots of booster doses in that clinic. Less frequently, we are going to still offer clinics dedicated to the 5 to 11 age group. We just loaded up another one for this weekend at the Penn Center, but we're probably going to still have the child clinics a bit separate from the clinics for age 12 and up, just given the entire experience for vaccinating children needs to be very different. We want to have a smaller, more controlled setting for that. And unfortunately, we're just not seeing the sheer numbers of parents signing up their children for vaccination. So we don't necessarily need quite as large a site for them.
And a follow-up?
No, that's okay. Thank you.
Great, thank you. So we've gone through the list now once. We still have some time remaining. So if anyone has any second questions that they'd like to ask, if you can just let me know in the chat and we can get to that. Okay, I see from Cord, you should be able to unmute.
If today you're reporting, I think it's 399 new cases, I think it is, and about 3,900 active ones. If we know that's not really an accurate number because of testing limitations and everything, what's your best estimate for how many active cases there really are in the community?
I don't think we have any good sense of how many there really are in the community. So I can't give you an estimate. All I would say is that I would guess it's probably at least 2 or 3 times higher, if not several more times higher.
Thanks.
Okay, not seeing any more questions in the chat. I think we will end up there. Thank you everyone for coming, and we'll see you again in a couple of weeks.